Welcome. So we haven't spoken to the public in a long time directly, so we felt that now was a great time to kind of reach out and explain a little bit more about what we know going forward with vaccine planning and kind of some of the things that have come up lately with COVID regulations. So we have Jack Wheeler, Steuben County Manager, and Darlene Smith, Steuben County Public Health Director, here with us today to answer a few questions and tell us a little bit about what to expect in the coming months. So to start with, there have been a lot of questions that we've been getting about the vaccine. What do we know? What can we expect? One of the very first questions is, will the vaccine be mandatory?
So not at any time soon. The COVID vaccine is going to be authorized under FDA's emergency authorization process. And under that process, it can't be mandated. So for the foreseeable future, there is no plan for it to be mandatory.
Great, thank you so much. How about, do we know if this will be a one-time vaccine, an annual vaccine? Do we have any idea about the schedule for this vaccine?
That is unknown at this time. What we do know is it'll be a two out of the three vaccine companies that we know of have developed a vaccine where it's going to be a 2-dose vaccine. The third company, it is our understanding that it'll be a 1-dose. But beyond that initial vaccination, because it's not yet known, the long-term protection that the vaccination is going to offer, it's not yet known whether or not it will have to occur more than once.
Great. Will it be free?
The good news is it will be free. The federal government made the purchase for all Americans to be able to get a vaccine.
Perfect. Do we know of any side effects yet?
So it looks as though the research has shown so far that potential side effects that are known at this point in time, they're calling it similar to what you might feel with a hangover. It sounds like some of the trial participants did have some aches and nausea, headache, things like that. So far, that's what's known.
And similar to any of the vaccines, all of the adverse effects will be tracked. So if after it becomes available to the public, all of that information will be stored and we can find out more information about that then as well. When do we think the soonest the vaccine will be available?
So all indications that we are hearing is that it's going before FDA approval. I read one report that there was at least one of the companies where they were going to file their application today. But certainly in the coming days, I think we can expect to see these vaccine companies be filing for their approval. And then from what we're hearing, it looks like sometime in December, later in December probably, will be the first shipment of FDA approved COVID vaccine.
Thanks. Will we be given some kind of card to identify that we've received the vaccine?
That is not known at this point in time.
But there will be some mechanism for tracking, kind of like with any vaccines. We have a system called NICES, which is the New York State immunization system that really does track, if you opt in, what vaccines you've been given. So there will be access to that. Maybe not a card, but there will be some way to prove that you've had a vaccine, just like with any of your vaccination records.
If an individual needed proof, so to speak, that they had received the vaccine, and if there's not a card, then certainly that information could be accessed through either the provider, that you received the vaccine from, or the local health department.
And do we know anything about the safety? Some people have concerns that it has been a fast-paced vaccine development. Do we know anything about what to expect as far as the safety or the efficacy of the vaccine?
So, Operation Warp Speed has definitely moved the COVID vaccine along in record time. There's no question about that. Again, the research and the data has demonstrated that with over right around 44,000 participants, that it has been a very safe process thus far. And then certainly that final stamp of approval will come from the FDA. So they will determine exactly if they feel it is safe enough for public consumption.
Great. And is there anything you'd like to share kind of about the system that public health is looking at to get or distribute the vaccines out to the public?
So we expect to hear soon that the vaccine will be on its way to us. We also expect that to be a very short notice. We may literally get it that day or the next day of when we find out it's being shipped to us. Once it is, we do have some tentative plans in place on how first we have to store it. And until we know which vaccine we will be receiving, we won't know which method of storage is the most appropriate, whether it can just be refrigerated or whether it will need to be on dry ice. And then from that holding point, we will get it out to the priority 1 areas, which is the high risk population and the essential healthcare workers. So we will be working extremely closely with our hospitals, our nursing homes, our healthcare providers, everyone who is slated to receive that vaccine in the first priority. Now, it's also possible that the feds will ship directly to hospitals or nursing homes or providers and bypass us. But we will certainly get a shipment, but they may concurrently ship to those areas. And so we just won't know until the time comes.
Mm-hmm. So keep tuned to our social media pages, both Instagram and Facebook, our website, Steuben County, or SteubenCony.org. We'll be releasing information through the media to make sure that what we have planned is shared so that everyone has access to the vaccine as soon as we have it available for them. So a couple of things that have been popping up in the investigations lately are how are people kind of spreading COVID, particularly in the workplace. If they are wearing their mask and they're staying at their desk and they're staying 6 feet apart, what are typical areas that we're seeing sometimes can be problematic for spreading COVID?
So we have seen a little bit of a common theme here. It's what I call the secondary activities, and as Laura Lee just mentioned, the break room at work, the common areas at work would fall under that secondary activity. I think that in general, folks are pretty diligent at following all of the COVID protocols as well as their workplace protocols in relation to their distancing and their using of masks, when they enter their workplace and when they're sitting at their desk or cubicle or distribution line, and then when they leave. But those secondary activities of going on a break with your workmates, eating lunch together with your workmates, we have had multiple cases of positive cases arise from those kinds of situations, which of course always leads to multiple contacts to that. So we really would like to remind everyone and caution everyone to keep that same diligence up when you do go on break, whether you walk halls together, corridors with your workmates, the distancing and the masks still need to occur. And the only time it would be best to not congregate in the cafeteria or the break room together. But certainly if there's more than one person in there at a time, the minimum of 6 foot distancing needs to occur, and the only time the mask should be off is when individuals are eating. So those are just some common areas that we have been problematic this fall, mostly.
Can you talk about the 10-person gathering limit that was recently implemented by the governor?
Yeah, I can take that. Thanks. So Sheriff Allard the other day put out a statement regarding that. Obviously, it's an executive order. I mean, we get a lot of questions about executive order is not law. That is not correct. Executive orders, because the New York State Legislature gave the governor expanded authority, whether anyone likes it or not, during this pandemic to issue executive orders, and they do have the force of law until overturned by a court or until the executive orders end. All that to say, the sheriff put out a statement, and we put out a statement last week as well, that no one from the county is going to be driving around, looking, counting how many vehicles are in a driveway. But we still have a responsibility to respond. We have responded to large gatherings and worked with those folks to disperse and to not congregate. If we get reports of large gatherings, obviously we do have a duty to respond, but it's not going to be a proactive driving down the street looking, counting cars and people. But all of that to say, and Darlene and Lauralee have both messaged on this a great deal, the holidays just have to look a little bit different this year. I mean, we all need to take extra caution in every choice that we make, with Thanksgiving coming up, with Christmas coming up, different holiday seasons, Hanukkah and others. We just need to think of, are these dinners with people outside your household, are these social activities essential? Can you do it through Zoom? Can you do it in another way? Because, the fact of the matter is that the rate of community spread around here is still concerning. What's happening throughout the country, obviously, there's other places that are more impacted than us, but our area still has a significant level of community spread. So, our message continues to keep your social circles as small as possible and think of a different way to celebrate with folks outside your household.
Mm-hmm. Can you explain kind of the yellow zones, what that means?
Yeah, so we were thankful to see last week that Steuben was removed from the yellow zone. Honestly, it came as a surprise to us. Lauralee and Darlene and Tim Marshall and all of us out here track the numbers daily. But, we were hoping that it would be this week that we were removed. It came earlier, but we still are, that's good news. That particularly impacts the schools. So there wasn't really significant restrictions on restaurants or anything like that. Instead of 10 people at a table, you could only have 4 people at a table, but it didn't reduce restaurant capacity. The big impact was testing at schools, and all of our staff, Darlene and everyone, did a great job working with schools, to make sure that they could test 20% of those folks who were on site. So we're glad to have the restrictions removed, but that doesn't mean we let our guard down. The daily positivity rate that we track out here is still very concerning. And as we've seen, we get about 15 minutes notice one way or the other. We'll get a call that says you're going into a yellow zone about 15 minutes before they announce it. And about 15 minutes before they announced that we were coming out, we got that call. So we don't know exactly when it'll happen, but our message remains to keep our guard up and to continue to make smart choices, because it's our collective choices that we all make that will determine where we are in a week or two.
Mm-hmm. And what do we know about hospitals and their current status and their availability?
So the hospitals, we do have daily conference calls with the 3 hospital systems in our county, and the purpose of that really is to just do a check-in, see what their bed capacity is, see what their surge capacity is. What we've learned is that certainly the hospitals, it's concerning. The hospitals, fluctuate day by day what their status is, but a couple of the systems are at or near capacity with their ICU beds as well as their COVID beds. But certainly the daily hospital checks, we did this back in the spring as well, in March, April, and May when we were at our peak at that point in time. And the purpose really is to just increase communication between them and us so that we can, on both sides, be prepared for what may lie ahead and future surges in the numbers of cases.
Yeah, and just to follow up on that, one of the things that folks will see, saw it in the Corning Leader and the Tribune. I know there's television advertisements. Guthrie and Arnott are working together for media advertisements about, how stretched a lot of the healthcare workers are in providing services, that, it's a very stressful time for them, and to wear a mask and to social distance and to keep your social circle small for the sake of our hospital systems and our healthcare workers. I mean, I know, it's disheartening to a certain extent how much, blowback local government and others have gotten in this when, we put out common sense messaging about these things. But, everyone seems to rally around the fact that our nurses, our doctors, our healthcare workers, are on the front lines, and we need to protect them as well. So we need to do everything that we can. And that's the message that's coming from Guthrie, Arnott, and I'm sure St. James would echo that too. So, we need to protect our hospital systems by making smart choices.
Right. Is there any messaging or any information you want to share coming up into the holidays with Thanksgiving next week? Anything people should be mindful about?
Well, in relation to Thanksgiving, I think Jack covered it really well, in talking about making Thanksgiving and Christmas, which will soon follow, probably needs to look different this year. And the governor has imposed the 10-person gathering limit in private residences, and so we would really just continue to ask the community and caution the community to, as hard as it is, to abide by that, and to be creative in the way in which you celebrate the holidays this year. We've heard it said before, and I think it's worth reiterating that by having a smaller family circle this year for Thanksgiving and Christmas truly might just mean that you will get to spend Thanksgiving and Christmas next year with your entire extended family, because perhaps those kinds of behaviors and decisions now will save someone, and so that everyone can gather together as an entire family next year. That would certainly be our hope.
And I think you've seen it, and we've talked about it, and, personally speaking about it, I mean, all of our holidays over, the past 9 months have looked different. It's not what I would have planned for my family and for my children, but I can tell you, my kids have enjoyed Halloween and other holidays just as much, even though we did it with less people. We did it in a distance fashion. We did it in a more creative fashion. There are ways to make a lot of these things still fun and enjoyable and meaningful for your family while also protecting each other.
Great point. One of the things the nurses wanted us to talk about is that they are still seeing where people, when they get tested, they're not staying home after their test until they get their results. And so that is posing a problem with gaining more contacts, potentially exposing more people. Is there anything you can say about that kind of behavior or the regulations you'd like to see?
Yeah, so the reason, once you get a COVID test, the reason that your provider tells you to stay home waiting for those results is because you don't know the results. I mean, if you're positive, you don't want to, while waiting for that test result, whether you have symptoms or not, and you don't want to be out and about in the community, potentially exposing more individuals, more places that you may visit. And if you are a contact to a positive, the reason that you have a 14-day quarantine imposed via a court order is because that is exactly the length of the incubation period for COVID. I know, to Laura Lee's point, we've had any number of individuals think that it's not all that important to quarantine for the 14 days when they are a contact because they feel good. It's not going to happen to me, and no symptoms, but quite honestly, the actual opposite often happens. And we have had multiple cases where throughout the 14 days, the individual felt fine, no complaints whatsoever. And then on day 13 of the 14-day quarantine, they begin to feel ill, come down with symptoms, and within just a couple of days, they end up being positive. The incubation period for COVID is 14 days. That's why the quarantine period for as a contact to a positive is also 14 days.
So are there any other messages or anything you'd like to share with the public?
In closing, I guess I just, like to say, we're very lucky to live in such a great community. I mean, we have so many people that are really, really doing just a phenomenal job. Everyone, obviously, not to use the cliche with the COVID fatigue, but everyone is a little sick of taking the prevention measures that we have. But it's really important to double down. If we look at what's happening in the Midwest right now, and the numbers that are happening even in Western New York, close to us, and in some other areas, the level of community spread is concerning. So you can still do things, and enjoy life, and in your very small social circle, still be able to interact with people. But we just really need to keep our heads down as we get into winter, because we're all driven indoors. The summer was not terrible on us in terms of cases, because most people were outdoors interacting, which obviously is safer. So as we're driven indoors, we just really need to double down on our efforts.
Yeah, and I certainly echo what Jack just stated very well. But I would also, I guess I just want to say thank you to the community and to the county residents. So many of you do what we ask and what we message about every single day. And sometimes we feel like a broken record out here saying, it feels like anyway, we're saying the same thing day after day in our press releases. But nevertheless, we're going to continue to say it, because that's what we all need to do. And so I really would, however, just like to thank the community and the residents of Steuben County, those of you who have listened to us and read the press releases and really tried your very best to follow all of the COVID protocols that come down with regularity, as far as even sometimes the changes that come from the governor's office, and also any number of you. Many of you individually and even collectively as organizations and businesses have reached out to us and shown your support in a variety of different ways. So I guess I'd just like to take this opportunity to say thank you for doing that. The smallest gesture really does help and boost our morale on a particularly hard day. So I would like to say thank you for taking the time to do that.
Yeah, absolutely. Well said.
Excellent point. So that concludes all of our talking points for today. Thank you for being here with us and listening to what we have as far as updates. We'll check in soon, I'm sure.
We will.
Bye.
Yes.
Thank you.
Thank you.